Hello po and magandang hapon. Thank you for joining us today. It is National Heroes Day actually and a holiday, but we are busy here to share with you a very interesting topic to a fitting end to our sight saving month. So, August po, aside from being breastfeeding month, is sight saving month. So, paano pangalagaan po ang atin pong mga mata? So, today we are going to discuss, this is very interesting actually, the number one cause of blindness in the world. Ito po ang katarata. So, ako po, for those who are new, I'm Dr. Ana York Bondoc. Thank you for joining us. And please follow us on YouTube and FB Live. Live po tayo ngayon. And please put your questions down below for any questions regarding cataracts. Kung meron po kayong kamag-anak na may katarata, paki-share na lang po. If you have undergone cataract surgery, please, you can share it also with us. We will read all comments and questions para po masagot po ng ating special guest. Today, we are also honored to have with us the chairman of ophthalmology of the Asian Hospital and Medical Center. She's a graduate of the University of the Philippines, like myself. She's also a mom, and she's very passionate po about cataracts. She will share with us later on the transplant program of the Asian Hospital and Medical Center for Corneal transplant. It's a big honor for us to guest today Dr. Beverly Dela Cruz-Rosas. Dr. Beng, how are you and good afternoon?
Hi, good afternoon, Anna. Well, it's a rainy day here, but it's so nice of you to invite us and, shed some light on cataracts for a lot of people out there.
Yan. Sige, Dr. Beng, thank you for joining us. Actually, nung nagre-research lang ako, dun ko nalaman na number one cause of blindness pala ito. And that really struck me.
Right. Mm-hmm.
So sige, let's read muna the case, okay? And then after that, kayo na. Okay, so may nagsulat po sa atin, Dear Dr. Beng and Dr. Ana, Mommy is 70 years old and parang lumalabo na po yung kanyang mata. So despite the pandemic, dinala ko po siya sa aming opta and we were told that she already has cataracts in both of her eyes. By the way, she is also diabetic. So we were advised that she needed to undergo cataract surgery at yung kanan daw pwede na but the kaliwa is not yet ready. So please advise us what are cataracts, we don't know, and what should we expect during surgery. So please help Dr. Ana and Dr. Ben. So Dr. if this family, kasi parang daughter yung nagpadala, no, and her mom went to your clinic, ano po yung i-advise niyo?
Okay. Well, at the age of 70, that's really expected, no? That's the most common cause of blurring of vision for senior citizens actually, no? Well, basically, ang cataract kasi, that's the clouding of our lens. Our lens is supposed to be crystal clear. It's like the lenses of eyeglasses, diba? It's supposed to be crystal clear. But then once you have some clouding, then the vision then becomes blurred, no? So that's what you mean that when you say you have a cataract. Now, when you say that sinabihan kayo na hindi pa hinog yung isa, tapos yung isa pwede na, because there are times that the cataract doesn't develop at the same speed, no? There are times that one will develop faster than the other one. Another thing to consider in the case of your mom is that your mom has diabetes also. Now, diabetes kasi, it really pushes the development of cataracts a lot faster. than if your mom didn't have cataract surgery. Now, unfortunately, as of now, there's no other treatment for cataract than surgery. So if your doctor says that one of her eye is ready for surgery, I suggest that you follow the advice of your doctor. Okay, Anna?
Yes. Thanks, Dr. Beng. Oo. So, can you, yung sinabi niyong sa 70, is cataract a disease of older persons? Or bakit when I was listening to Bamboo, may binanggit siyang child with cataract?
Okay, because cataracts kasi can really, even if you, sometimes you can be born with cataracts. Now that's what you call congenital cataract. Sometimes you can have traumatic cataracts, anything from an injury. Sometimes you can also have cataracts because of certain illness like diabetes. But the most common form of cataract is because of aging. No? We cannot say that our whole body will age and our eyes will not. So the most common way that the eye ages, I mean internally, is by developing cataracts. No, and then you can, this is why it's more common to diagnose cataracts among senior citizens. No, so at the age of 70, usually meron na talaga yan. No, so it doesn't mean that pag 70 o operahan ka na. There are times kasi it depends on how far advanced it is. There are some people at the age of 70, hirap na talaga sila, they cannot function na because of their cataracts. But there are some 80s na sila, 85, kayang-kaya pa nila mag-function. So usually the doctor decides based on how it affects the activities of daily living of the patient. That's it, Anna.
Ayan, okay. So thanks, Doktora. Question, nabanggit
Uh-huh.
po nung nagtatanong na she noticed na malabo na yung mata ng mother niya.
Mhm, mhm.
Napapansin ko, kasi I'm not an ophthalmologist eh,
Yeah,
napapansin ko and the picture show that there's a cloud, parang namumuti yung mata.
yes.
Or when people look at you, hindi masyadong malinaw. Can you tell us the other symptoms? How do you know pag may katarata na? Or,
Okay. Well, the very first thing was when you go to the doctor's office or to an ophthalmologist office, number one, we really have to check your vision. Visual acuity is the most important thing that we do first and foremost, no? Because based on the visual acuity, we can more or less gauge how the patient sees, no? There are some patients that can see just light, no? uh, it has to be very bright light for them to identify the light. There are some patients who can read very big letters only, but their usual 2020 letters they cannot read anymore. No. So secondly is by history. If the patient really says that there's cloudiness of the vision, then that's a big sign that the patient has cataracts. And the third most important one is we do as what you call slit lamp examination. No? That's like the microscope ng mga ophthalmologists. No? The patient sits down and puts the chin in this chin rest, and with the use of a special microscopes, we can look into the lens and see how far advanced is it affected by the cataract. So that's basically how you diagnose cataracts in a patient.
yan. Doktora, sa mga may
Uh-huh.
edad po, how often should they go for an eye checkup? Tapos nabanggit nyo na rin that diabetics
Mhm.
are more prone to cataracts. So,
Yeah.
if you're
True.
older, yeah, paki-advise, like, what is the checkup? Kasi baka you are still able to read, yung pala meron ka ng beginning cataract.
Yeah, that's true, no? But actually, senior citizens, everybody actually the best release every year, no? It doesn't mean that you change your glasses every year or something's done to you every year, but it's really better, no? Once to every 2 years, or if you have diabetes, it's more important to see your doctor every 6 months to 1 year. Now you were asking Anna, no, how does diabetes affect the cataracts? Okay, just for an example, no, I have this patient. He's only 34 years old and he came to me recently because he had blurring of vision. So when I saw him, diabetes kasi presents with a different kind of cataract. Eh. There are different types of cataract when you look into the microscope. So when I saw him, he has what we call posterior subcapsular cataract. I'll explain it more later, no? Now, because of this, I got to ask him, do you have diabetes? And he never knew that he had diabetes. So we did a workup on
Wow.
diabetes, and they were so shocked because his sugar levels were very high, no? So
Wow.
he's scheduled for surgery, no? But it's a blessing in disguise that he had blurring of vision, because then at least we can treat also his diabetes and control his blood sugar as well, no? Now, I mentioned a while ago, no, that diabetes presents as a different type of cataract. Okay, for you to understand it more, no, isipin natin yung lente natin parang mangga. Okay? 'Di ba? Yung mangga, meron yung takip sa harap, meron yung buto, meron yung takip sa likod. Okay? And that's located inside the eye. These are connected this is inside the eye and connected by zonules na in the periphery. Now, the most common form of cataract starts sa buto, sa seed ng mango. Okay? Then the second one starts dun sa laman ng mangga, or that's what we call the cortex. Now, diabetic cataracts usually starts in the posterior capsule, or yung pinakabalat ng mangga sa likod. So when a doctor, an ophthalmologist, sees that there's opacification or cloudiness in that portion of that cataract, what you call the posterior capsule, we already start considering that the patient might have diabetes now. More often than not, the patient does have diabetes now. So treatment has to be done, really, no, systemic treatment, and then once the patient is cleared, then you go and do the surgery.
Do this.
So it's very
So
important that
grabe, doktora, kayo pang nag-diagnose ng diabetes niya.
hindi niya alam, yeah, and he's very young at 34. His vision is not that good anymore, no? And that's why when we did his workup and I referred him to an endocrinologist, sure enough, he does have diabetes. So he's undergoing treatment right now. No? So it's very important not
Wow,
only to see
that
an ophthalmologist, but see an internal medicine, once in a while, just to make sure, because the earlier you catch these diseases, prevention is better than cure. No.
so late dapat ayusin yung asukal ng mga may
Yeah,
diabetes, otherwise they will develop akala ko it's more of the vascular, so may issues din pala ang cataract sa diabetes.
yeah, especially if you have
I'm
a family
ano,
history, if you have a family history of diabetes, always make sure that you have yourself checked also once you reach the age of siguro. Minsan kasi 20s pa lang may diabetes ka na eh. So really depends on your family history as well, no?
okay.
It's better to know earlier.
Okay. So, doktora,
Yeah,
I'm not an opta, so lahat ba ng cataracts inoperahan or meron bang treatment na hindi operation?
unfortunately kasi talagang it all goes and boils down that the treatment now of cataract is really surgical, no? So, wala eh. The eye drops, well, some say it slows it down, but honestly, nothing really has been proven to take away cataracts except surgery. Yeah.
Okay. Doktora, ito, magandang tanong ito
Mhm.
dun sa patient kasi sinabi niya, and kami as internists and
Yeah.
parating ano ba yung hinog sa hindi hinog? At what is ngayon na binanggit niyo pa yung mangga, so all the more.
No
Ano
naman.
yun?
No naman. O kasi may
Ako, I'm confused as an internist. Why do they say that? And is that still, ano ngayon? Is
okay.
that still something to be considered?
Okay, yung mangga may hinog at hilaw din, no. Actually, I just made use of that. My patients kasi understand it more when I talk about
No,
it that
ako
way.
rin, na-gets ko
No?
when you said that. I got it well.
They
Oo.
get to understand, the cataracts can start in different parts pala of the lens, no? Okay. Kasi ganito yan. Ngayon talaga, hindi mo na, doon talagang, when I was still training, meron yan, Lola, hindi pa po hinog ang katarata nyo, follow up pa po kayo, lalo na yung PGH, di ba? We had so many patients, we
Yeah,
had to
oo.
prioritize. So those with the more advanced cataracts, those are the first ones to have surgery. Okay, it's like this kasi, no? When you say hinog kasi, it's really actually more or less the stage, how pronounced or how significant the cataract already is. Sa ngayon kasi, hindi na natin pinapahinog. Okay, before, the treatment of cataract before kasi is we do um, the eye itself, you make a very big incision so that the whole lens, o isipin nyo, yung buong mangga, makakalabas. So for you to take out the whole lens, you have to make an incision or a cut in the eye to allow the lens to go out. During that time before, when that was the method of choice, it's best to do that when the cataract was a little hinog, in the sense na talagang ano na siya, medyo pag kasi yung catarata humihinog, tumitigas yan eh, no?
Mm.
Um, it's easier to push it out pag medyo matigas siya, right? Like, it's easier to push out a candy outside the hole compared to jelly ace, diba?
Oo.
So
Oo.
that's the way the surgery was done before. Pag mas matigas, mas madaling ilabas. But now, the method of choice is what we call phacoemulsification. In phacoemulsification, the cataract itself, we have to dudurog into very small fragments so that the incision is very small, that you don't even have to put sutures in it. So at this stage,
Wow.
this point of time, mas mabuti na hindi pa sobrang advanced ang cataract kasi mas mahirap gawin, mas mahirap durugin pag ang catarata sobrang tigas. Let's say it's like this, no? 'Di ba, ang hollow block mismo, pag binagsak mo, durog ka agad, no? Pero ang hollow block na punong-puno na ng semento, mas mahirap durugin, 'di ba?
Okay.
So you don't want it to reach that point. Because once you do it that way, you have to use mas mahirap gawin eh. Mas madaming energy kailangan gawin. Mas complicated sa mata. Pero kung malambot lang siya, na mas madaling tanggalin, it makes everything easier. No? So,
Doktora, I'm an internist and ngayon ko lang I am learning this myself. Kasi parating may hinog na we
yeah.
always, yes.
Yeah.
So
That's
I'm learning a
true.
lot.
I
Oo.
know.
Can
Thank
you,
you. Yeah.
yeah, I'm learning. Is this what they popularly call laser surgery? And is this now the
Okay.
standard of care throughout or meron pa bang gumagawa ng older technique?
The
Hindi ko
other
alam because
one,
yun nga,
yeah,
I'm
the
not an
other
opta.
technique is
Oo.
the other technique now, which is called the extracapsular extraction. Actually, it's still being done in some places, and there are some instances where it's needed. But the standard of care now is basically phacoemulsification. Now, in phacoemulsification, there are some incisions that are done. Okay, when you say laser surgery, the laser machine takes place and does all these incisions instead of the doctor doing it manually, no? But to be honest, mas madami talaga na gumagawa na yung wala yung laser. Number one, the cost is very prohibitive, very very expensive, no? And number two, after the laser does its work of doing the incisions, the rest is still done manually by the doctor. So presently, the standard of care is phacoemulsification. But all these things, kasi your doctor has to discuss with you to determine which of the methods would be best for your eye. Kasi iba-iba yan eh.
Okay.
Mm-mm.
Yan. Um, if late na yung cataract na matigas, is it still better to do the old? Is there time, there's a time na it's better to do the extra capsular? May, is it depending on the grades? Like, how would you know
Yeah,
how to choose is my question? Oo. Pag
okay.
sinabi na ng doktor, paano mo alam kung ano yung bagay sa'yo?
Actually, pag sobrang-sobrang tigas na talaga, no, and it really depends also, no. There are times that it's so hard sometimes, uh, baka it's better to take it out the old way. But then, most of the time, us doctors, us ophthalmologists, we really want to opt it na phacoemulsification para maliit lang yung
Maliit lang yung
incision.
sugat, oo.
Oo, no? But, you know, sometimes kasi talagang pag sobrang tigas, they call it brunescent or brown cataracts, and it's going to be very dangerous na because if you exert so much energy and so much power into the eye, there are times it's not safe anymore, then it's better off to do the capsular extraction. So that's why what
Doktora,
we
oo, sige,
yes.
okay.
Yes, Anna.
Pardon my ignorance, how will the laser pulverize hindi ko alam, is it like
Okay.
an ultrasound? Paano siya?
Yeah, yeah,
Okay.
you're correct there, no? The laser that I mentioned a while ago, it usually does the incisions in the cornea, the incisions in the capsule, all the incisions it does. But to pulverize or to fragment the cataract into small pieces, that's where the ultrasound waves come in, no? You start chopping it into pieces, and then with the use of ultrasound waves or phacoemulsification, dinudurog unti-unti yung cataract, no? Tapos, papasok ka na ng parang suction, i-aspirate mo na, sisipsipin mo na palabas yun.
Sisipsipin
So,
yung natira, oo.
yeah, sisipsipin na yung mga durug-durug na particles. That's how you do it now.
Ang dami ko nalalaman. Doktora, what is it that they will replace? Ano yung wa-
Okay.
uh,
Oh,
kasi the only thing I know about cataract was when this ophthalmologist who works with us told us na donated daw yung lens. Hanggang dun lang yung alam ko na donated.
okay.
So let us know.
Okay.
Kasi we
Kasi
don't
you have,
know. And then, I know the Rotary donates lenses, tama
yeah,
ba? And
uh,
yeah,
yeah,
what is it that people put? Oo.
okay. Because, when you do cataract surgery, the basic thing is you take out the lens, but then you have to replace this lens with a new or artificial lens. Ewan ko, Ana, kung ikaw natatandaan mo pa, no, before there were these mga lolos and lolas, you'll see them with glasses, with parang lenses that look like magnifying lenses. Yung sobrang kapal talaga ng lens nila after surgery. It's actually like a magnifying lens kasi mga +10 yung grade doon eh. No? That's what happens if you do not replace your natural lens. Because the natural lens of the eye is the one that contributes the most to the grade of your eye itself. No? So if you take that out and you do not replace that with an artificial lens, then you will not be able to see. For you to be able to see, that's the time that you have to put glasses. But the glasses kasi with very thick lenses like the magnifying lens, di ba, napakabigat nun. It's very uncomfortable. So the best really is to put an artificial lens inside. So that's when you replace the lens inside the eye. By taking out the cataract, then replace with an artificial lens. That's how you do it.
Doktora, may nagtanong thank you for that. So now, napapalitan, okay? Kasi
Yes.
dati,
Oh.
yung
So
concern ko lang magkano yung lens. Yun.
ano
So,
ang lens? Well, depende
yeah,
po
kasi
sila.
sinabi sa akin nung naggumagawa sa amin sa province, sa district hospital, nakahanap daw siya ng donor ng lens. Is this a big issue?
Kasi, you know what, anything naman kasi, di ba, kahit sa damit, may iba-ibang costing yan, no? Merong made in India, may made in Germany, may made in China, iba-iba, no? All of this really affects the prices, no? So number one, the brand and the type of lens really affects it also. There are lenses, okay, balik tayo to make people understand, 'di ba? Pag bumili tayo ng salamin, may murang lente, 'di ba? Meron sabihin sa'yo, Dok, papagawa ko na lang sa Quiapo, mas mura, minsan 350 pesos lang. Tapos meron namang lente na medyo mas mahal. Pati yung klase ng lente, pag doble vista, mas mahal yan. Pag may astigmatism, mas mahal yan. Ganon din ang lente sa pinapasok natin sa mata. May lente tayong single vision, meron tayong lenteng with astigmatism, and meron tayong lenteng tinatawag na multifocal. ang multifocal, ang pinaka-high-end. That's what you call the premium lenses. No?
Wow.
So, the price range is really, really wide. No? So, lahat yan, it's being discussed also with the patient by the doctor para the patient will make an educated decision on what type of lens he wants, ano ba yung budget ng patient, no? Because of course, we all have to work within a budget. But sometimes it's our responsibility as doctors to educate the patients that these are what are available, no? Then you choose, sabay kayo, no? You guide the patient kung ano yung best for the patient.
Yan.
Mhm.
Magandang matagal na akong doktor. This is the first time for me to know that there are different choices of lenses. And then,
Yeah.
depende kung anong
Naku,
kailangan
ang
mo.
dami. Mhm. Lalo na now, so many available talaga in the market. But then, syempre,
Okay.
most of the time, you will choose whatever medyo tried and tested mo na, no, or your colleagues, no. So, ganun yun.
Okay. So, your doctor will recommend also what you
Yeah,
need and based, of
yeah.
course, on your
Mm-mm.
budget. Okay.
Yes, oo.
Okay.
No? Kaya dapat,
Doktora,
sometimes
yung
kasi,
ano, is there a
oh,
Oo, sige.
that's
Sige po.
sometimes, di ba, dapat like our listeners now, no, I would encourage you, pag mag-consulta kayo sa mga doktor nyo, you ask questions, no? Kasi sometimes me also, I have patients who seek second opinion. Minsan naoperahan na sila, doon sila magsisik ng second opinion. Tapos may mga problema. And then, hindi talaga nila naintindihan what they were going to go through. So, it's very important talaga magtatanong kayo parate sa doktor ninyo, no? Because that's what you're paying for, eh. You have to be educated. Your doctor should educate you on what you have and ano yung mga options, no? Para alam niyo kung anong pipiliin, kung anong dapat gawin.
Okay. Very, tama naman. Oo.
Oo, di
Doktora,
ba?
is it okay if we ask a few questions or we pick up a few from from the
No
audience?
problem, yeah. No problem.
Ayan, si Miss Reina, can you read? Kasi baka may katarata
Yes
na ako,
po.
hindi ko na mabasa dahil maliit.
For Miss Gemma Baricio sa Turay, good PM, Doktora. Ask ko lang po, wala mi cataract, 70 na po ako. Lagi po nagluluha at kumakati ang mata ko ngayon. Ano po dapat gawin ko? Salamat sa sagot.
Okay. Sige. Nanay Gemma, o at least, no, sa ganitong edad, siguro hindi pa kayo na-diagnose ng cataract, no? Malamang meron yan kahit bahagya, pero ang pinakareklamo ninyo ngayon, nagluluha ang mata ninyo. Well, ang isang pa problema kasi sa ganitong edad po, no, lalo na senior citizen na po, nagluluha ang mata ninyo kadalasan dahil nanunuyo. Okay? Dry eyes. Sabihin niyo hindi nga nagluluha, bakit dry eyes? Kasi ganito yan, no? Ang mata natin, consistently, dapat may level ng moisture yan. Dapat may pagkabasa talaga yan, no? Yung cornea natin, talagang may tear film yan. Pag nagda-dry yan, nagsisend yan ng signal sa brain natin na, uy, tuyo ang mata mo. Kailangan mo nang basain. It's time na gumawa ka ng tears. So, minsan, magsisend yan ng feedback mechanism sa ating tinatawag na lacrimal gland, yun ang gumagawa ng luha natin, magpo-produce naman yun ng tears, no? So, that's what happens, no? Yung panunuyo ng mata mo, para para maging basa ulit, yung brain mo ang nagsisend ng signal na parang, uy, kailangan mo na ulit gumawa ng luha. That's one reason. Another reason, pwede naman barado yung daanan ng luha nyo. Both, kailangan makita kayo ng ophthalmologist para ma-diagnose kung anong pinakamabisa para sa inyo. Kadalasan talaga dry eyes yan eh. Tapos usually, ang dry eyes, yun, malaking tulong talaga yung mga eye drops, yung tamang eye drops na ibibigay sa iyo ng ophthalmologist mo, nanay. So, I hope, Nanay Gemma, klaro naman po at naintindihan ninyo.
Doktora, there's a question here. Is
Mhm.
cataracts only for seniors? I think siguro let's expand it na lang. What are the other types, causes of cataracts? Aside
Okay.
from, yun nga,
Aging.
degenerative siya, people get
Oo.
older, then
Mhm.
diabetes, and then I saw kay Bambo nga si congenital. Are there any
Um,
other ano that would cause someone to have cataracts?
well, trauma, no? Any form of trauma, lalo na yung penetrating or yung natusok. Then another cause talaga yung mga naka-prolonged steroids, no? Steroids is one of the causes talaga, prolonged steroid use, no? Whether it become oral or pamatak na steroids, it also causes cataracts. So basically, yun yung mga common talaga na causes, no? Congenital, aging, trauma, diabetes, steroid use. Yun yung mga pinaka-common na causes ng cataract natin.
Okay.
Pero
Thanks,
number one
Doctora.
talaga
At
is
least
aging. Yeah.
diabetes and aging.
Yeah, aging. Aging is the first, no?
Aging is the first, oo.
Ha?
Meron pong natanong dito,
Okay.
are cataracts genetic? Like kung na-cataract surgery yung tatay mo, maka-cataract surgery ka ba?
Okay, madalas yan tinatanong sa clinic din talaga, no? Kasi ganito yan eh. Parang tinanong natin sa sarili natin, is aging genetic? 'Di ba? Lahat kasi tayo tatanda, 'di ba? So, it follows, lahat tayo magkakaroon ng cataract. Pero iba-iba lang kung kailan tayo magkakaroon. Since diabetes, yon ang genetic din. So kadalasan, pag may diabetes yung mga magulang mo at maaga nagkatarata, malamang ikaw ganun din ang magiging history mo. No? Pero yun na nga, lahat tayo kakaroon ng cataract because it's basically a degenerative disease. Yun yun.
Okay. Here's another question. Okay.
From Miss Rory Rose Perea of Piazza. Hello po. My mom is 67 years old. Na-diagnose po siya ng cataract. Last time po na nagpagawa po ng eyeglasses. Hindi pa po maooperahan. Saan po ba pwede magpa-opera at a cost na medyo kaya po namin? Salamat po. Ito po ba ay need na immediate maoperahan? Though sabi po hindi pa daw po hinog. Thanks po.
Ayan na nga yung hinog
Okay.
issue,
Oo nga.
Doktora.
Oo nga. Actually, it's the easiest way kasi para maintindihan ng patients na pwede pang hindi, no? At least para more or less ma-appease din sila na, oh, sige, hindi pa naman emergency, no? Kasi kadalasan ang katarata naman elective surgery, no? At the age of 67, kadalasan talaga, minsan pwede pa namang hindi, no? Medyo matagal naman bago talaga sumuper hinog yung cataract, eh, no? Ngayon, ang dahilan kung bakit nagpapalit ng salamin, no? Sayang din kasi minsan eh. Gaya minsan, papagawa ka na ng salamin ngayon, Rory, tapos after 6 months, magrereklamo na naman ulit yung mami mo na lumalabo ulit. Kasi nga, because of the development of the cataract. No? So sometimes, yung ibang optical, mabait, no? Pag nakikita nila yung cataract na, magre-refer sa doctor. And then kami, kung nakikita namin na hindi na makakatulong ang salamin, we would rather advise the patients, huwag na kayong gumastos sa salamin, save na lang natin, 'di ba? Now, as to the question kung saan pinakamura magpa-opera, talagang definitely all
Government.
government hospitals talaga. Yun lang nga, dahil sa pandemic ngayon, mas mahirap talagang magpa-schedule, no, sa government hospitals. No? Because nga nagiging COVID center sila. Yun lang yung, that's the reality now.
Yan na nga. Yan na nga.
Yun na nga, oo.
Yan, Doktora, ayan, ito,
Yeah.
nababasa ko. What to expect from surgery? Like, is this true na 15 minutes lang po talaga yung surgery? And what do you advise your patient to expect on the day? Like, how should they prepare, day off, day after, parang ganon?
Okay, kadalasan surgery, cataract surgery, no, it really depends. Usually we tell the patients it's less than an hour. So usually mga 15 to 30 minutes yan. But sometimes kasi pag mas mahirap operahan yung cataract, humahaba, no? And you have to realize it's not really a question of speed. It's always a question of safety. Kasi yung iba sabihin, ay gusto ko yung 10
Tama.
minutes mo. Ay kung di naman safe, di ba? So the doctors really don't go in, and the aim is to finish it as soon as possible. The aim is to do a safe surgery, no? So yun ang kailangan tandaan ng mga tao, no? Yun ang gusto namin mga doktor na gumawa ng safe surgery talaga, no? So kadalasan gising, no? Pag inooperahan kayo, and yung mga ibang pasyente doon natatakot, no? Kasi syempre mata yan, tapos sa operahan. We always tell them, para kasing pumupunta ka niyan sa dentista. 'Di ba ang dentista, hindi naman masakit, pero uncomfortable. 'Di ba? Sino bang gustong pumupunta sa dentista? Yung sa mata, pag ooperahan ka, ganun din. Hindi siya masakit, pero syempre, hindi mo sabihin talagang super comfortable kasi nakahiga ka, tapos meron kang instrument na para permanently nakabukas ang mata, no? And then you won't feel pain actually, no? You won't feel pain, but you will feel water, you will hear certain sounds, no? So normally that we tell the patients that para medyo alam nila kung anong i-expect, no? Better kasi talaga na local anesthesia because it's just a short procedure, no? And the risk of putting the patient to sleep, no? Mas magandang local, no? Pero kung talagang sobrang nervous yung pasyente, then that you have to discuss with the patient, no? Then after surgery, kadalasan, you're up and about the next, actually it's an outpatient surgery, so you can go home right away. And then the next day, the patient is also up and about. Ang bawal lang yung magbuhat ng mabibigat, bawal magkukusot ng mata, no? Kadalasan ayaw muna namin maligo sila na talagang shower tapos buhos sa ano, because we're trying to protect the eye para wag magka-infection, para hindi marab yung mata, para yung sugat na maliit hindi bubukas, no? Things like that, no? But in general, you know what, parang ano, para ka nga din galing sa dentista, binunutan ka ng ngipin, bukas, kinabukasan, parang medyo okay ka na naman, ganun din yung sa mata. And then healing time, at most mga 4 weeks yan, you're healed, no? But a lot of patients, less than 1 week, pumapasok na sila, no? So cataract surgery is
Okay.
generally safe, no? It's generally safe surgery.
Yeah. Doktora, ba't may nakatakip sa mata nila when they go around? Opo.
Okay, ngayon nga hindi mo na nga tinatakpan ng iPad eh. Goggles na lang, 'di
Oo,
ba?
parang there's this like
Oo.
metal.
Yeah,
Oo.
ngayon hindi na kailangan 'yon. Dati,
Hindi na. That's old. Oo.
goggles na lang ngayon. Yung mga goggles natin, parang
Yeah, I
ganun.
saw some people wearing goggles.
Goggles na lang ngayon. Dati kasi, talaga you really have to cover it with a metal na may butas-butas because nga, yung incision, malaking-malaki. So, you really want to protect it na hindi
Ah.
i-rub ng patient. So, to prevent the wound
So
from
ngayon, yung mga
opening.
naka-goggles, yon.
Yun ang mga naooperahan ng cataract. Yung mga nakikita mo na goggles, kadalasan mga naoperahan ng cataract yun. Oo. So, ganun na
Okay.
siya ngayon.
Doktora, question, if you have cataract surgery, let's say
Mhm.
you were using multifocal lenses previously, is it possible na makorek na yung long-sightedness and short-sightedness or
Yeah,
hindi
that's
ko
the
alam?
purpose. Yeah, that's the purpose of the multifocal. Siguro you were saying your question is kung gumagamit ka ng salamin or glasses that's multifocal or progressive. Meron din ganun na lente na pinapasok mo sa loob ng mata which will cover for your far vision and for your distance vision. Pagka ganon, kadalasan, your dependence on glasses is very small compared to a single vision lens, wherein most of the time you will need additional reading glasses.
Yeah. So it's possible to be glasses free if you choose those
Yeah,
kinds of lenses.
yes, it's possible to be glasses free. Oo. Tapos ano ha,
Okay.
yung lens na nilalagay, um, panghabang buhay na yan. Unlike glasses that you change regularly, yung implant, we call it the implant that you put inside the eye, panghabang buhay na yan. Hindi mo na kailangan paltan. No?
Okay, next
Yan.
question
That is
po.
a good point. Oo, next question daw.
From
Ayan.
Miss Florita Solis, safe po bang magpa-opera during pandemic?
Ay, napakagandang tanong yan. Doktora, please enlighten us.
Well, you know what? The hospitals naman, especially like the big hospitals, we have safety mechanisms in place, no? Meron tayong mga HEPA filters, meron tayong negative pressure operating rooms, and as much as possible, we really try to do everything na hindi tayo magkakaroon ng COVID during the surgery. But then again, walang doctor na we cannot guarantee 100% kasi pumunta ka nga lang sa grocery, pwede ka magkaroon ng COVID di ba? But then, hospitals now, like kami sa Asian Hospital, everything is done by scheduling, even in our outpatient, no? So we have less patients compared to before because nakaschedule lahat yan So talagang in terms of social distancing, mas konti talaga ang taong may encounter mo. And then in the surgery itself, in the operating suite itself, may mga safety mechanisms in place as well. So, yun
So,
yun.
best effort.
Best effort, yeah. Best effort, di ba? Mhm.
Oo, kasi you could get sick, but on the other hand, the surgeon could also get sick from you. So, kailangan talaga ng ingat for
Pero
everyone.
tama ka doon, Ana, no? Kasi minsan, meron kaming pasyente, hindi namin akalain na for surgery na siya, hindi namin akalain na may COVID. Talagang no
Positive
symptoms
pala.
at all. Turns out positive, di ba? So, hirap di ba? We're really
It's
not in
difficult.
it's a difficult situation that we are in talaga.
Yan.
There's a next
So, thanks,
question.
Doktora. Okay, Miss Reina, question.
From Miss Melanie Dawagan Pagyan, good afternoon po, Doc Ana. Palagi po ako nanonood sa live nyo. Thank you so much po, dami ko pong learnings. May tanong lang po kay Doc Beverly. Wala po akong cataract since college po ako nagsusuot na po ako ng eyeglasses. And every year po, pag nagpapacheck up ako, tumataas grado ko. May medicine po na pwede ko inumin para hindi na po ulit tumaas ang grado ng mata ko. Thank you po.
That's
Okay,
a good
Melanie.
question.
Yeah. Well, Melanie, based sa picture mo, no, sa picture sa Facebook mo, mukha namang, siguro, I don't know kung how old you are na, but siguro pa-adult ka na or adult ka na. Kasi ang grado ng mata talaga, habang bata ka, medyo pataas ng pataas yan, no? Pero usually, pagdating mo ng mga 20s, nag-ano na yan, nagiging stable na yan. Ngayon, yung iba, kaya lang naman pinapalitan din yung salamin, pag, let's say, hindi na maganda yung lenses, no? Pero ako, ang suggestion ko talaga, you stick to one, no? Kung meron ka talagang doctor, you stick to one doctor para nakikita mo talaga yung progression ng grade. Because minsan, kung ang change lang ng grado mo is plus 25 or minus 25, pwede namang hindi paltan, no? Pero kung ikaw ay pupunta sa iba-ibang optical, syempre, hindi mo alam kung wala kang record So, kung ako I always tell my patients that it's best to see yung record mo kung ano bang nangyayari talaga sa grade mo, no? And then there will come a time na magsa-stabilize naman talaga yan. And then your doctor actually should educate you also. Ganito yung tinaas. Tapos, kasi di ba pag pinapagawan ka ng salamin, meron tayong tinatawag na subjective, yung pinapaltan ng paltan yung lente sa ano ng mata mo para papiliin ka kung ano ang final na grade na gusto mo. Kung iba ito dun sa existing classes mo, then pinapaltan yung lens. Not necessarily because na sumobrang taas, but sometimes talaga because of the quality or at that point in time, medyo mas malinaw ng konti pagdagdagan natin ng a change in plus minus 25 to 50. Hindi naman ganun ka-alarming yon, no? And unfortunately, wala tayo talagang gamot para hindi na tumaas ang grado natin. Sana meron, pero sa ngayon, para sa blurring of vision talagang
Wala pa.
access, wala pa eh. Sana meron.
Yeah. Yan. Doktora, I will ask this question na po. How do we
Okay.
get, thank you so much for telling us a lot about cataracts. Ako
Naku.
personally, I learned a lot. I didn't realize it was under local anesthesia.
Ah,
So, at least I
yeah.
know a lot more. Ay, di ko alam. I
Gising.
couldn't imagine. Oo.
Mm.
Akala ko monitored sedation man lamang, pero pwede palang local.
Hindi
So
pwedeng monitored
that's
sedation,
something
ha?
for me to know about.
Oo. There are really some patients na kailangan monitored sedation, no? So, depends sa comfort zone ng doctor and patient eh, no? But kadalasan
Okay.
local anesthesia, next monitored sedation.
Okay.
Hindi ganun kadalas na general anesthesia. Lahat ito kailangan
All right.
pinag-uusapan.
That
Kaya ang dami talagang kailangan factors pinag-uusapan bago mag-opera. Dapat talaga educated yung patient, no? Bago kayo pumayag, you have to be educated. It's the doctor's role na talagang turuan kayo. Ito ang mga choices, tapos i-guide kayo. Hindi yung kaagad, kailangan nyo kayo
yeah.
operahan. Payag kayo, hindi. Hindi tama yung ganun. Kailangan ay hindi
Hindi dapat ganon. Yeah.
Hindi dapat gano'n, you know. I think, Anna, no, as doctors, it's our role to educate our patients, no. But that's what I tell my
True.
patients always. You have to make an educated decision para, you know, your partners, you and your doctor, you choose that what's right for you, what's best for you. So, ganun yun.
Yeah. Doktora Beng, last question on cataracts. And then puntahan
Okay.
natin yung bagong ng Asian. What's
Sige.
the oldest person na na-opera nyo?
Ay,
Kasi
ako,
sabi nyo, degenerative. Yes. What's the oldest?
yeah. Well, my oldest was 99. My oldest was 99.
Wow!
She lived to be 102.
Na
No?
nakakabasa na.
Yeah, and she was malakas siya eh. Probinsya, she was strong. But ang general age na naoperahan ko, 70s to 80s. 80s pwede pa. Madalas na pag 90s, medyo takot na yung mga kamag-anak, ayaw na eh. But yung 99 po kasi, talagang very, strong pa yung pasyente kong
She was
nun.
very active. Oo.
That was years ago. Talagang siya mismo gusto. Very clear mind. She really wanted the surgery. So, nakakatuwa naman. Nabuhay pa siya ng till 102.
Wow, that's very inspiring, Doktora. That is good.
Oo.
Very nice. Oo. Doktora, we also invited.
At the time nga yata, hindi pa phaco nun. It was the other kind of surgery eh.
The more, the bigger incision
That was years ago. I was still starting my practice, yeah.
Galing.
Yeah.
That is good. Oh, that is good. Doktora, we also, one of the reasons that I invited you is, I was checking the page of Asian. Nakita ko po yung video nyo about corneal transplants. Can you introduce this video and tell us a little?
Okay. Sige. Siguro para people will more or less understand what I'm going to talk about. Anna, if you will allow me to show a short video, and I think they will enjoy it because it's by Bamboo. Sige.
Yeah.
Hello, I'm Bamboo, and I'd like to introduce the Corneal Donation Program of Asian Hospital and Medical Center. This program was inspired by the touching story of Aniela, who was born at Asian Hospital on June 28, 2017. Aniela was suffering from a congenital disorder and would only have a few hours to live after birth. With this knowledge, the family wished to leave a legacy for baby girl Aniela and pre-consented to organ donation upon her demise. Aniela passed away 14 hours after birth. Only her eyes were eligible for donation since all her organs were underdeveloped. Her mother donated them to the Eye Bank Foundation of the Philippines, Aniela's eyes were gifted to two fortunate recipients, and one of them is Nikki. Now, Nikki was diagnosed with congenital glaucoma, a bilateral blinding eye disease if left untreated. With the help of glaucoma surgery and the generous donation of Aniela's eye, Nikki can now see and is a very active and independent 5-year-old girl. Aniela is a hero. She has inspired Asian Hospital to partner with the Eye Bank Foundation of the Philippines, now in its 4th year. Asian Hospital continues to advocate for eye and cornea donation. So let's be a hero to someone's eyes. Give the gift of sight. Asian Hospital Medical Center is one with the Eye Bank Foundation Philippines in its advocacy for corneal donation. Be a hero in someone's eyes, the gift of sight, and be a corneal donor.
Ang ganda naman, Doktora. It's very inspiring. Please tell us
Yeah.
more.
You know what? I've seen that video several times and still it hits me pa rin, no? And we're very, very glad and grateful to Bamboo that he actually, he said yes to being our spokesperson for our program, no? And Ana, I'm so thankful talaga na pinayagan mo kaming ipakita tong video na to, no? Kasi alam mo sa bansa natin hindi pa masyadong accepted ang corneal donation, no? Or organ donor, no? Ang corneal donation kasi syempre lalo na pag nawalan ka ng mahal sa buhay, parang isipin mo, ba't mo kukunin yung mata, di ba? But by doing this, kaya yun yung advocacy namin, no? Para sana dumami yung mga tao na willing mag-donate ng cornea. Minsan kasi, meron kaming mga pasyente na namatay na merong wish yung pasyente, the one who passed away, na maging corneal donor siya. Pero ayaw ng mga kamag-anak. So, nawawala, no? And sayang yung opportunity na makatulong. Kasi, you imagine, no, you passed away already, but still, you go on living by allowing other people to see. Kaya nga itong story ni Aniela, baby siya na namatay, the mom was lucky kasi alam niya that the baby was going to live only for a few hours. And she was able to prepare herself. And she thought, paano ko ba mapapahaba ang buhay ng anak ko? And that's the way she decided to donate her eyes. And nakakatuwa because when we made this video, nag-meet yung parents ni Nikki, yung binigyan ng mata, at parents ni Aniela, yung nagbigay ng mata. And maiiyak ka talaga kasi sobrang tuwa,
Masyado
very touching.
nakaka-touch, Doktora.
Sobra talaga. And yun ang gusto namin kalat sa buong Pilipinas, no? We want people to know that if you donate your eyes, if you donate the eyes of your loved ones, you will really change the life of other people. You could help minimum of 2 people if you donate your loved one's eyes. And you have to realize, pag tinanggal naman yung mata, let's say you passed away, your loved ones passed away, tinanggal yung mata, hindi mahahalata. There's no deformity or anything. When my father passed away, we donated his eyes, no? And it gives you a sense of, it makes you happy, eh. It gives you a sense of hope even at time of death because you know that you're going to help somebody else have a better life. So yun,
Ang
Ana,
ganda
talaga
naman.
ang gusto naming yun ang advocacy ng aming department ngayon, no? So I hope yung mga listeners nyo, ikalat nila. And if you want to be an organ donor, i-type nyo lang yung Eye Bank of the Philippines and then meron doon to be a cornea donor. Pwede ka na maging donor, no? Para if the time comes that, we will all pass away naman. If the time comes, you can have in your wallet, or you can inform your relatives na I want to donate my eyes when I pass away. Hindi, it will not change how your loved ones look. Para lang din silang tulog, pero nakatulong ka. So talagang, nako, that's an advocacy that us ophthalmologists would really want to pursue and to push.
Na-touch din ako doon, doktora. It's a beautiful advocacy. Yes.
Yeah.
Oo. Oo. Yes. Thank you so much for educating about cataracts, also for opening the door for
Yes,
organ donations. Yes.
anytime, anytime.
Yeah. Any last words of inspiration sa mga tao, doktora? Both
Okay.
about cataracts and corneal donation. Oo.
Okay, sige. Sa mga listeners ni Ana, no, salamat and thank you for joining us this afternoon, no. Ang sa akin talaga, the best is talagang prevention is better than cure, no. So umpisa pa lang magpa-check up na kayo habang bata pa kayo, pa-check up yung mga anak niyo regularly, no. And then kung may mga magulang din kayo, no, it's best na malaman niyo na kung may cataracts talaga sila. It's best na malaman niyo ng early on para makasave na kayo unti-unti. Because yes, medyo may kamahalan at times ang cataract surgery. Depende kasi kung saan gagawin, kung anong lentid gagawin at lahat. But at least, kung malaman niyo ng maaga, pwede na natin ipunan konti-konti, no? And huwag kayong matatakot sa cataract surgery because cataract surgery is one of the safest surgeries talaga, no? So, tungkol naman sa cornea donation, tulad ng sinabi ko, kung interested kayo maging cornea donor, no, log in lang kayo sa iBank of the Philippines, tapos nandun yung link kung paano kayo maging cornea donor. Tapos kung pwede nyo lang i-share yung video ni Bamboo sa mga Facebook walls ninyo, makakatulong din to para buong Pilipinas malaman na there's such a thing as cornea donation, no? Para lahat tayo makatulong sa isa't isa, no? Remember, one eye donated, you will change the life of somebody else and make it a lot better. Thank you, Anna, for having
Ako,
me.
thanks so much, Dr. Beng. What a beautiful day pa naman, National Heroes Day, ano?
Yeah, National Heroes
Yes,
Day. Be a
yes,
hero.
you can be a hero.
Be a hero.
Yes.
Donate your cornea. Yeah, that's true.
Yes, thank you so much, Dr. Beng. Thank you so
Oh, it
much.
was my
To
pleasure,
Asian Hospital and
Anna.
Medical
Thank you.
Center, mabuhay po kayo with this beautiful advocacy.
And thank you for what you're doing, Anna. God bless you.
Thank you, Doktora.
Bye.
Okay, so thank you so much, Dr. Beverly Dela Cruz-Rosas. Ang ganda po ng sinabi niya. Ako personally, I'm an internist. I learned so much about cataract surgery and how to advise my patients who have cataracts. And before I send them to the ophthalmologist, alam ko na kung anong i-advise ko sa kanila. For those naman po who are not consider to be an organ donor. Ako po, I'm saying it in public. I've told my husband. Well, I'm now telling you. I also told my mom when my mom was still alive and I wasn't married that I would like to be an organ donor. Not only a corneal donor, gusto ko talaga i-donate. Okay? So, I am very much decided matagal na po about organ donation. I hope you consider that din po for your family and for yourself. So before we close, batiin lang po natin yung mga nagtanong na baka hindi na po na-pick up. Please read yung kay Ma'am Cindy.
Yes po. From Miss Cindy Abinas Cantillo. Wow, good PM po. Na-touch po ako for a moment dun sa video. Thank you.
Ako rin, Ma'am Cindy.
Hello po, Doktora. Good afternoon po from Miss Elena Esguera.
Elena, good afternoon.
From Miss Florita Solis, I'm watching from Orani, Bataan. God bless po.
Thanks, Ma'am Florita.
From Mr. Mac Napoles, watching from Quezon Province.
Wow, nasa Quezon pala si Sir Mac. Sir Mac, how are you?
From Mr. Medras Nogoy Jeronimo. Gandang hapon po, watching from Visal, San Pablo, Candaba, Pampanga.
Thanks, Ma'am Remedios. Thank you.
From Miss Daisy Agcauli Jacinto. Good afternoon po, watching from Isabela.
Wow, ang layo. Thanks, Ma'am Daisy.
From Miss Gemma Abaricio Saturay. Thank you, Doktora, sa sagot nyo. Sabi nga po ng doktor ko, dry eyes daw ako. Thank you po sa payo ninyo. Di ko na kasi napapatakan eh.
Okay. Thanks, Ma'am Gemma.
From Miss Julieta Estrella Regasa. Good afternoon, Doktora. Watching from Mandaluyong.
Thank you. I'm from Mandaluyong too. My driver is still in Mandaluyong according to Benji.
Yeah. From Miss Florita Solis. Nakakatouch ang video. Real hero.
Yan, maganda.
That's all that we have po.
Okay, so sa inyo po lahat, cataracts is the #1 cause of blindness po sa Pilipinas and throughout the world. We are, August is sight saving month. So ang ganda na din yung sinabi ni Doktora, no, we actually should have our eyes checked regularly. Kasi hindi lang naman katarata ang mga problema, but we need to be aware of different conditions po sa mata. Sa mga bata po na nag-online school and gaming, and to the parents, please monitor your child's online use. Nakaka-damage din po ito ng mata. Actually, I have spoken to a pediatric ophthalmologist. Ang dami daw nagpa-glasses ngayon ng mga bata sa online use. So, I think I'm going to repost, kasi mag-start na naman ng school. I'm going to repost po yung aming information about protecting your eyes ngayon pong panahon po ng online school. So sa inyo pong lahat, I hope you learned about cataracts. I certainly learned a lot. I hope you consider organ donation. Na-share ko naman po that I want to be an organ donor. So sa inyo pong lahat, magandang hapon po. Thank you so much and goodbye.